this is the lower respiratory tract. Infection of the lower respiratory tract is called lower respiratory tract infection. Infection of the upper respiratory tract is called upper respiratory tract infection, right? So this is the hyoid bone. You know that, right? Hyoid bone. These are ligament and connected with this thyroid cartilage. These thyroid cartilage are not complete. They are not complete ring. They are like they are in the posterior side. The posterior side, you will see the space in the posterior aspect. You will see space. So if you see this way, see right here. If you see this way, so in the up to here only thyroid gland exists. Okay. On the posterior side, there is no thyroid gland. I mean thyroid cartilage. Okay, and the thyroid cartilage. Below the thyroid cartilage, this cartilage is complete ring. Okay, this is a complete ring. It surrounds all the tubes. This is called cricoid cartilage, and these are called tracheal cartilage, trachea. Okay, so they are also half ring. They are not complete, and they are not completely surrounded to the tubes. They are just half C-shaped cartilage. This structure is called thyroid gland. Okay, thyroid gland release hormone T3, T4, and controls body metabolism. So if they ask you what is this, thyroid gland, cricoid cartilage, thyroid cartilage, right? Thyroid cartilage, hyoid bone, and this structure is called epiglottis. Okay. Below the epiglottis, you can see here opening. That's called glottis. Epiglottis, glottis. When you swallow food, the tongue, this tongue right here, press this area. Okay. Press this epiglottis. Epiglottis completely close this area right here. Epiglottis, glottis. So the food is not going to this respiratory tract. Okay. Food is going to the esophagus. So esophagus is here. The tube is here. See, this one is esophagus, food pipe, esophagus, and this is a trachea. So if you're talking and you're laughing and eating food, sometimes food will go inside and you go there and you block this, and you're going to choke. Okay, person can choke because the food will enter inside the vocal cord. Okay, so this one will be closed down, and food will enter to the esophagus, food pipe. Okay, so you can open up this one. See, you open this one, you can see here. So they might ask you during exam they might ask you like this, and you have to find out the different parts of the internal structure of this respiratory tract, lower respiratory tract. So this structure is called epiglottis. Okay, epiglottis will close down this glottis, so the food cannot enter inside the respiratory tract. Okay, so this one is called vestibular fold. This is called vocal fold. Vocal fold produces sound wave. Okay, this one. Vestibular fold do not produce sound wave. They are the ligament. They helps in the production of the sound. And in the top right here, this area, corniculate cartilage. Okay, this is called corniculate cartilage. This corniculate cartilage actually connected with the cuneiform corniculate cartilage. Okay, corniculate cartilage, cuneiform cartilage. Okay, corniculate cartilage. Okay, helps to open and close this vocal fold. And this one is called arytenoid cartilage. Corniculate arytenoid. Okay, a cuneiform is right in the posterior side of the cuneiform. You cannot see from here. Okay, there are 3 cartilages, and you can see here. This is called thyroid cartilage. This one is cricoid cartilage. Okay, remember cricoid cartilage, this one is this, and this one. Thyroid cartilage is this one. Sorry, this one, thyroid cartilage. Cricoid is this one and this one, right? And this one is called epiglottis. Okay. What else? I'm not finished. So I already told you about this thyroid. I told you about this trachea. No, this is the thyroid cartilage. Right? I told you about thyroid cartilage. And you go trachea is here, right? Trachea, if you look on this one, you can see ending of the trachea right here. This is called carina. Okay, this is right bronchi, right bronchus, left bronchus. Since the right lung has three lobes, and these secondary bronchi enters to the first, second, and third lobes. Okay, the secondary bronchi. Primary bronchi turns into secondary bronchi. The primary bronchi turns into secondary bronchi. Okay, there is only two lobes in the left side of the lungs. That's why they have a secondary bronchi enters to the superior lobe and inferior lobe. So right lung has three lobes. Okay, right lungs have three lobes: superior lobe, inferior lobe. No, superior lobe, middle lobe, inferior lobe. Superior lobe, middle lobe, inferior lobe, right? Whereas left lung has only superior lobe and inferior lobe. Left lungs don't have middle lobe. Got it? And another structure you're supposed to know. Yeah, this one is a diaphragm. Okay, this one is diaphragm. This structure which separates lobe, transverse, and this one is an oblique fissure. This is a transverse fissure, oblique fissure, and the left lung only it has oblique fissure. Don't have transverse fissure. Okay, so that's the difference between these fissure and lobes. So why this structure a little bit the space is taken, space is like a curve, because of position of the heart. Okay, apex of the heart will be here and also in the above this diaphragm. So if you remove this one, okay, so you can see here this one is a secondary bronchi, right? And it goes all the way down inside the lungs. This bronchi turns into tertiary bronchi. It's called tertiary bronchi. And tertiary bronchi eventually turns into bronchiole, and bronchiole turns into don't have any kinds of cartilage. They are surrounded by the smooth muscles, and bronchiole actually ends with the alveoli, ear sac. You cannot see ear sac here, okay? But you can see here the red one. See this red one? They are called pulmonary arterial vein. Pulmonary vein, right? Red one. They carry impure blood, right? And these are called pulmonary. Blue one is called pulmonary artery. Pulmonary artery carry pure blood. And this structure right here, these structures tertiary bronchiole convert into alveoli. Okay, so here this structure is trachea. Behind the trachea we have esophagus, and this structure is called inferior, descending aorta. Okay, this is the descending aorta, and this one is the ascending aorta right here. And when it make curve, this area is called aortic arch, and you can see there are 3 blood vessels. I can see only 2 blood vessels right now here. This one is called brachiocephalic artery. It branches into right common carotid artery and subclavian artery. And also you can see here, second one, this one is called left common carotid artery, and this one is the left subclavian artery, right subclavian artery, right? And this is the venous system, and there's a heart will be here. So this one is called superior vena cava. Blood is coming from the head and also from the arm. This is called superior vena cava, and this one is called brachiocephalic vein, and this one is the internal jugular vein. External jugular vein is not here. Okay, and this one is called subclavian vein, right subclavian vein, left subclavian vein, and jugular vein. Okay, all these blood vessels drain blood to the superior vena cava and goes to the right atrium. I cannot see. Okay, this structure. This is the part of this esophagus, food pipe, and opens to the stomach. Okay, opens to the stomach, and this one continuation of the descending aorta, or you can say near the abdominal cavity, abdominal aorta. Okay, and remember the abdominal aorta. There's a blood circulation coming out from here. This is celiac artery. Remember celiac artery? Right here, celiac artery. And these are dome-shaped structure is called diaphragm. That's it. Thank you. You have any questions?